Good morning. My name is Dr. Anupama Singh, and I'm a senior consultant in internal medicine at Apollo Spectra, New Delhi. Today, I'm going to be talking about the management of diabetes mellitus. I'm going to try and explain how to manage diabetes mellitus in very simple language so that everybody can understand how they should go about managing their blood sugars, as well as what are the additional things that they need to take care of when suffering from diabetes mellitus. While it is commonly and of course rightly believed that the key to management of diabetes mellitus is to basically manage blood sugars. It is not the only goal when managing diabetes mellitus. Now, there are five critical endpoints which should be managed while managing diabetes mellitus, in addition to maintaining normal blood sugar levels. So let's first take them. Let's take these points up one by one. And first and foremost, of course, is lifestyle management. Now, this is usually what people have the most questions about, and also I think it is one of the most important things in managing diabetes long term. Now, what does lifestyle management comprise of? Most importantly, it comprises of diet. What is, and this is what people have the most questions about, what is a diabetic diet? Now, a diabetic diet is basically no different from having any normal healthy diet. And a normal healthy diet basically is a diet that comprises of plenty of fiber, fresh fruits and vegetables, whole grains, and it's low in refined sugars as well as in fats. Now, this is also true of a diabetic diet where the diet should comprise of whole grains, fresh fruits, vegetables, fiber, and there should be, a restriction in the consumption of refined sugars or refined carbohydrates. Um, it's when I say there should be restriction in refined carbohydrates. What is refined carbohydrates? First, let's define what refined carbohydrates are. So, when I say refined carbohydrates, I basically mean white sugar or refined sugar, and also refined flour. Like maida or all food groups that are made with refined flour, like pastas and these are the carbohydrates which will spike your blood sugar or increase your blood sugar very quickly, and so should be kept to a minimum in the diet. Now, the other thing is what are complex carbohydrates and what about fruits? And these are commonly asked questions as well. So, complex carbohydrates, the total energy requirement or total caloric requirement on a day, in an entire day, at least 50 to 60% of that should come from carbohydrates and should come primarily from complex carbohydrates. And complex carbohydrates basically are the cereals that we consume. So, the roti and the chawal that you eat are basically complex carbohydrates. Also, fruits are simple sugars, which will give you, like fructose is a simple sugar which is found in fruits. And fruits should be consumed because even though they do have sugars, they also have a multitude of very beneficial, vitamins and minerals and are very good for the health. So they can be consumed. You need to be careful about consuming some fruits which have a very high GI load or a GI index, and where you need to basically control the portion size. But all seasonal fruits can and should be consumed by diabetics. Now, usually one serving of fruit should have about 15 grams of carbohydrates. And so fruits which have a much higher carbohydrate load. For instance, a common question asked is, can banana be consumed by diabetics? Now, bananas do tend to have a very high carbohydrate load, though they are excellent fruits and an excellent source of fiber and other vitamins and minerals. So, yes, they can be consumed. But here's my suggestion: a large banana has about 30 grams of carbohydrate. So, maybe consuming half a large banana at one sitting, which is equal to 15 grams of carbohydrates, is something that a diabetic should choose to do, or basically control the portion size. Instead of having one entire large banana at one sitting, have half a banana. Similarly, for mangoes, this is the mango season, and many diabetics have this question: Can I eat a mango? So again, uh, about 15 grams of carbohydrate in one sitting as a snack. So half a mango, half a moderately sized mango will give you about 15 grams of carbohydrates, and there's no reason why a diabetic cannot consume that during the mango season. So, similarly, when you come to other food, for instance, how much fat should be consumed, how much protein should be consumed by diabetics. So, like I said, 50 to 60% of your total caloric requirement in a day should come from carbohydrates. About 20 to 25% must come from proteins, and the rest can come from fats. But what is important to understand here is that the saturated fat, the content in your diet should be less than 7%. So less than 7% of total calories in a day should come from saturated fat intake. And by saturated fats, I mean fats like ghee. So that is about diet. Secondly, lifestyle management also comprises exercise. Again, a very, very important factor in managing your blood sugars or in managing your diabetes. And exercise has numerous benefits. One, of course, it has an insulin sparing effect or increases the insulin sensitivity of the body. So when you exercise, your insulin, which is consumed by the body or which can be utilized by the body rather, is the utilization improves and there's increased insulin sensitivity, and as a result of which your sugars are better managed. Maybe if you're on insulin, your insulin requirement may decrease. If you're on oral medication, your dose may also decrease. Now, it is important to get at least 30 minutes of regular exercise, like walking, for at least 5 days a week. So the recommendation is for 150 minutes of exercise in a week. And this is something that is very, very important. Not only will it help you keep your blood sugars in check, it will help you maintain a normal body weight. It will also give you other health benefits by reducing your risk of heart disease, and is on the whole very, very important if you want to manage your diabetes well. Now, in addition to diet and exercise, what are the other things that you need to take care of when we talk of lifestyle management? Smoking is a very important. So, if you're smoking, quit now. If you do not smoke, do not begin to smoke. It is very, very important to not smoke when you suffer from diabetes. In fact, it is important not to smoke whether or not you have diabetes. For everybody, smoking is the one habit that needs to stop. Alcohol consumption, again, alcohols basically are just calories or sugars which are adding to your diet, and they don't give you any nutritional benefit. So if you do like your drink, I would say the recommendation is 1 unit of, so 60 ml of alcohol in a day if you are a male, and 45 ml of alcohol a day if you are a female. Now, if you do not drink every day and you want to drink only, say, once a week or on the weekend, the cap continues to remain the same. So it would still be 60 ml of alcohol for a male or 45 ml of alcohol for a female. It cannot be 60 ml into 7 because you're drinking 1 day a week. Now, apart from these important factors, finally, there is the stress management as well as sleep. Now, it's very important to manage your stress, which also has a negative impact on your blood sugar levels, and also to get a restful good night's sleep. Uh, Ideally, an 8 hours of sleep over the night, which is starting by 10 or 11, uh, and it's uninterrupted, would be the ideal sleep. Try and avoid sleeping late, which again impacts your health negatively and may also impact your blood sugar management negatively. Now, this is basically lifestyle management. Now, the second thing that's very important in diabetes management is managing your blood sugar. So you'll see that many times, or in fact, uh, almost 80% of all patients with diabetes mellitus also tend to have a high blood pressure. Now, it is important that the blood pressure be maintained in range in all patients with diabetes. So, not only does your blood sugar have to be normal, but your blood pressure also should be maintained below 140 millimeters of mercury by 80 millimeters of mercury if you have diabetes mellitus. If you have diabetes mellitus with additional risk factors like heart disease or other comorbidities, then your blood pressure should be maintained below 130 by 80 millimeters of mercury. Now, only by keeping both your blood pressure as well as your blood sugars within range can you reduce your risk of both microvascular complications like diabetic retinopathy, where the eyes get involved, or your kidney gets involved, or your nerves supplying your lower limbs and the rest of the body get involved, or macrovascular complications, where you can develop heart disease, you can develop ischemic disease to your blood vessels and other you can have a stroke, which is also a macrovascular complication. So it is important to keep your blood pressure in the normal range. Now, the third endpoint that we're looking at is keeping your cholesterols in check, also known as your lipid profile. Now, in addition to having normal blood sugars, having your blood pressure in the normal range, your cholesterols also need to be in the normal range in order to reduce your risk of heart disease, to reduce your risk of stroke, or reduce your risk of developing other complications of diabetes, like loss of vision, which is a dreaded complication, or chronic kidney disease, or loss of sensation in your lower legs, or even ischemic disease, or reduced blood supply to your limbs. So, what is the cholesterol that we are looking for? So, what we're looking for is a bad cholesterol level of below 100 milligrams per deciliter. If you already have heart disease or suffer from comorbid from cardiovascular disease, then the bad cholesterol should be kept below 70 milligrams per deciliter. Now, the good cholesterol should be more than 40 milligrams per deciliter to afford any protection to the heart or to give you any kind of protection. And the triglyceride levels, again, very important, because often the kind of lipid profile that we see, especially in Asian diabetics, is a low good cholesterol and a high triglyceride levels. So the triglyceride levels should be below 150 milligrams per deciliter. Now, it is important to understand again, what causes a rise in cholesterol and what causes a rise in triglyceride levels, because often there is a lot of confusion in what really contributes to cholesterol in our diet. So, cholesterol is any fat that really comes from an animal source, and typically that would be dairy. So, the milk that you're consuming, butter, cheese, ghee, from eggs, and from meat. So, this is your only source of cholesterol in your diet. Now, triglycerides, on the other hand, will come from any plant based oil that you use in your diet, and typically that is a cooking oil that you use. It could be any oil, it could be mustard oil, it could be sunflower oil, it could be soybean oil, or even olive oil. Whichever oil that you're using can contribute to raising the triglyceride levels. And so the key is really to use the minimum amount of oil possible while cooking. It's not so much which oil, because many people seem to think that using olive oil, they can be more generous with using the oil. That is not true. You must try and minimize the amount of oil that you're using in your diet. Now, then coming to the fourth endpoint that's important in the management of diabetes is screening for complications so that early intervention can happen. Now, it's important to screen for both microvascular complications as well as macrovascular complications of diabetes. As I said earlier, microvascular complications are basically complications of the eye, where you can develop diabetic retinopathy, of the kidneys, where you can develop diabetic nephropathy, and of the nerves supplying your body, where you can develop diabetic neuropathy. The macrovascular complications that you can develop are basically cardiovascular disease, where your heart may be impacted. You can have you can develop macrovascular complications of the blood vessels supplying your brain, where you are at risk for stroke. And you can also develop peripheral arterial disease, where the blood vessels supplying your limbs get narrowed, as a result of which there is ischemia, which is peripheral arterial disease. Now, screening for macrovascular and microvascular complications should occur at diagnosis in case of type 2 diabetes mellitus. And in case of type 1 diabetes mellitus, it should occur after 5 years of having had the disease. Now, in the absence of any diabetic retinopathy, the recommendation is that you can get your a very you can get the eyes dilated and have an extensive check looking for diabetic retinopathy every 1 or 2 years. But of course, if you have changes of diabetic retinopathy, then this should be done every year. Uh, uh, Screening for diabetic nephropathy is easy to do and can be done during routine checkups when the blood sugars, the glycated hemoglobin are tested. A urine albumin creatinine ratio can also be tested in order to screen for diabetic nephropathy. In case of diabetic neuropathy, again, it can be done in the clinic with filament testing, and your doctor would be looking for diabetic nephropathy every time that he examines you. It should be done at least once a year, and in case some changes are found, then maybe your doctor will suggest further screening in the form of tests. Now, macrovascular complications, again, we can test for the heart, where a treadmill test can be done, or a stress echocardiography can be done as suggested by your doctor, and can be done as often as your doctor thinks it's necessary, but typically once in 3 years would be adequate if there are no other signs of heart disease. And finally, and the most important endpoint that we're looking for, of course, is normal blood sugars. So the target blood sugar range, or the target HbA1c, again, a lot of controversy with some people looking at much more intensive blood sugar control, and other people looking at blood control, which is not very, very intensive, or a little permissive. Now, the recommendation in young people is to keep the HbA1c at 6.5% or below 7%, definitely, because that's been shown to reduce your risk of microvascular complications. It can also have a slight or slightly reduce your risk of macrovascular complications, though it has not been shown, intensive control has not been shown to have any mortality benefits in terms of macrovascular disease, but it may reduce your risk of non-fatal myocardial infarctions or non-fatal heart attacks. Now, in older people or in people with comorbidities or who have developed complications of diabetes, perhaps a little more permissive HbA1c, where the target HbA1c could be between 7% to 8%, is allowed, because it's been that very intensive reduction in blood sugars in elderly people may negatively impact longevity. So I would say that the target roughly is a fasting of between 90 to 120 milligrams per deciliter of sugar, and a postprandial of below 160 milligrams per deciliter in younger individuals or in individuals below 60 years of age, which could be a little more permissive, a fasting of up to 130 milligrams per deciliter and a PP of up to 180 milligrams per deciliter in elderly people or in people with comorbidities. An HbA1c of below 7% or up to 6.5% in younger people, and an HbA1c of 7% or slightly more in older people is acceptable. So basically, management of diabetes is really effective and can reduce your risk of complications of diabetes only if all of these 5 target endpoints are met. So it's not just about keeping a watch on your blood sugars, but it's also about keeping your blood sugars, your cholesterols under control, of eating a well balanced and healthy diet, of exercising on a daily basis, maintaining your stress, and having a good night's restful sleep, along with seeing your doctor on a regular basis, doing a quarterly glycated hemoglobin, and checking for complications at least once a year. Thank you.